Welcome to Baltimore, a city with a rich history and a complex relationship with drug abuse. In the 1960s and 70s, Baltimore was a thriving city, known for its bustling neighborhoods and close-knit communities. However, the 1980s brought a new challenge, as Baltimore became ground zero for the crack cocaine epidemic devastating families and communities. The crack epidemic fueled a surge in crime, poverty, and violence, leading to widespread social and economic devastation. In response, the government implemented aggressive law enforcement tactics and crackdowns on drug-related activities.
The problem: individuals living in impoverished areas in Baltimore are grappling with soaring rates of opioid addiction.
A new first-of-its-kind nationwide database developed by Hearst-owned the San Francisco Chronicle, along with other newspapers owned by our parent company, tracks overdose deaths across the country down to the county level. That information was just published about an hour and a half ago, and Baltimore City ranks at the top of the list in overdose rates across the country at 174.1 drug overdoses per 100,000 people.
And in the shadow of economic despair, opioids thrive. It's not just a correlation, it's a stark reality. Economic hardship fuels the opioid crisis.
The innovative solution involves the creation of a mobile recovery unit to address the issue of addiction in Baltimore directly. This initiative brings essential support and resources to addicts where they are, breaking down barriers to access treatment and support services. The MRU serves as a beacon of hope and a lifeline for individuals struggling with addiction, offering immediate assistance, counseling, referrals to treatment programs, and ongoing support on their journey to recovery. By mobilizing resources and expertise, the MRU revolutionized the approach to addiction intervention, reaching underserved populations and fostering positive change within communities.
There are many stakeholders that affect the feasibility of the MRU implementation. This recovery unit is relying on altruistic motivators from healthcare professionals and social workers to address substance abuse disorders, which is likely since it has a direct impact on underserved communities. Next, the local government would require incentives to allocate resources and budgeting towards the MRUs. And government officials will likely follow evidence-based guidance that reaches the underserved demographic to lower the rates of substance use disorders in the city. However, budgetary constraints could limit the ability to deploy a significant number of vehicles to hotspots. Then, nonprofit organizations could offer assistance and support with grant acceptance for MRU, which is likely based on their role in addressing systemic issues. Also, employers in Baltimore would likely support this initiative to improve the well-being of their entire community, considering homelessness is disproportionately high in areas with high rates of substance abuse disorders. Lastly, community members must actively seek these resources and give informed consent for treatment. MRUs rely on the intrinsic motivation of the drug addict to seek treatment from medical professionals. In 2017, only 5.7% of the 18 million struggling with substance abuse disorder even felt they needed recovery treatment. So this may be difficult to gain the trust and participation from community members struggling with drug addiction. From a market perspective, addressing the $30 billion cost of opioid addiction in Baltimore will help reduce the burdens on the healthcare system and help bring individuals and communities towards recovery.
First, there's overdose prevention, notably the expansion of naloxone, a life-saving overdose reversal drug. Naloxone is easy to administer and relatively inexpensive, with a $1 copay. It has been pivotal in changing the approach of frontline officials toward drug use and addiction. However, naloxone doesn't address the root cause of addiction. Initial efforts to train the public face challenges with low attendance and often not reaching those most at risk. Moving on to on-demand and long-term recovery services, including a 24/7 hotline. Baltimore streamlined resources to launch a 24/7 phone line, providing immediate referrals to addiction counselors and crisis services. This includes assistance with urgent appointments, fostering engagement. However, despite the effectiveness of medication-assisted treatment, MAT, There's a notable shortage of treatment centers nationwide, limiting accessibility. The Crisis Stabilization Center offers crucial support, providing medical screening, behavioral care, and MAT induction. Yet space limitations and cost make it challenging to scale, with only one center currently operational. In looking at locations of drug treatment facilities throughout Baltimore, we conclude that while Baltimore is doing a lot to address the opioid crisis, we are in need of comprehensive and sustainable solutions.
Imagine a Baltimore where every individual struggling with addiction has access to compassionate and comprehensive support services. At Bubbles Hope, we envision a future where MRUs inspired by the spirit of Reginald Bubbles' Cousins from The Wire serves as a beacon of hope and healing in our community. Like Bubbles, who overcame his own battles with addiction and became a source of support and guidance for others, our MRUs are dedicated to breaking down barriers to care and empowering individuals on their journey to recovery. Our MRUs serve as mobile hubs of community engagement, providing information, resources, and a listening ear to those in need. Just as Bubbles formed connections with fellow residents of Baltimore, our staff built trust and rapport with individuals, meeting them where they are with empathy and understanding. Inside the MRU, individuals receive high quality medical care, including counseling, medication assisted treatment, and health screenings. Our goal is to address the physical, mental, and emotional aspects of opioid addiction, supporting holistic healing and recovery.
Value proposition. Bringing sobriety to you. Our mobile recovery unit provides private and local recovery services fitted to your needs. With our trained specialists spanning many areas of expertise, we offer assistance to help guide you in your journey to sobriety, keeping your dignity intact. Organizational chart. The mobile recovery unit will be led by a director, overseeing two important areas: the clinical manager and the operations manager. The clinical manager will be over the licensed practical counselors, as well as nursing staff, including RNs and LPNs, whereas the operations manager will be over several positions, including community outreach, intake coordinators, marketing, and administration.
MRE funding could be accumulated through many ways, mainly through grants and public-private partnerships, otherwise known as PPPs. The government currently offers the Substance Use Prevention, Treatment, and Recovery Services Block Grant, which could help funding, implementation, and tracking of all the resources within the MRU. And then you have the other source of the PPP, which can help provide infrastructure for this project. Securing resources includes those employer partnerships to help staff the medical professionals and the infrastructure. The medical and counseling staff would have to be identified and recruited to work in the MRUs. Additionally, there must be case management services to monitor the progress of the patients and potentially a partnership with the clinic for a referral service if needed at a hospital. Lastly, an accreditable pharmacy should be funded to supply the MRU. Lastly, using data analytics, a data research team could identify key hotspots for MRUs, meaning areas that are underserved communities with high levels of drug abuse disorders.
And beyond direct service provision, we advocate for systemic change and policy reforms that prioritize addiction treatment, harm reduction, and social justice. Like Bubbles' determination to make a difference in his community, we are committed to creating a more equitable and compassionate society for all. At Bubbles Hope, our vision for MRUs is inspired by the resilience, compassion, and hope embodied by Reginald Bubbles' Cousins. Together, we are building a brighter future for Baltimore, one step at a time.